the seniors, those who are sitting as seniors there in the webinar. I apologize that I will talk about certain diseases today, and we may not, this talk may not be very exhaustive one, and the information related to the homeopathy still remain unexplored in this webinar today. Well, gradually we will explore all the dimension of homeopathic treatment. And today chosen, we have decided that we'll talk about the chronic kidney disease. We all know well, in our country, in India and in subcontinental countries of around the India, the basic nature of the diseases are the same. Like in Sri Lanka, like in Bangladesh, the nature of the diseases are same, the lifestyle almost same. So that could be the reason that the disease pattern that been followed, that been followed in each country around our own country, India. So it is true that the kidney diseases uh, is increasing, is increasing everywhere around the world. And the basic cause of increased number of chronic kidney disease is that we have prolonged the life expectancy. One of the cause, as we all know, that is a hypertension. I think Dr. Asan, somebody should mute it because some howling is coming. Somebody should, or you from your part you can mute. Uh, this is some howling coming, and if everybody mutes, yeah. Thank you so much.
I think it's a nice so
Yeah. So it is nice. It's nice. We have planned to talk about the chronic kidney disease today, and we'll be talking into it. As I was sharing that the kidney disease is increasing around the world because the life expectancy has increased. Means the average age of a person is increasing and increasing globally. And patient has to suffer from certain disease. And one of the diseases is one of the diseases is the chronic kidney disease. So we have to be alert about it. We have to get an idea that how to make early detection of the chronic kidney disease. How will prevent the chronic kidney disease, and whenever we get a chronic kidney disease case, how will tackle with that. It is true that in chronic kidney disease cases, that by homeopathic treatment, sometime alone by homeopathic treatment, we can very nicely can tackle a case. A chronic kidney disease can be from uh, from childhood to the geriatric population. So wide range of the ages are there to tackle with the chronic kidney disease. It's not a disease that in certain period it will occur and in certain period it will not occur. It can occur from childhood to the old age. Anytime it can occur. And we call a chronic kidney disease a disease which is the kidney disease when it is more than 3 months of time. Whenever a person has an elevated chronic or elevated jeopardization of kidney function, more than 3 months, then we call that one is a chronic kidney disease. Below the 3 months, we call that is acute kidney injury or acute kidney disease. That is absolutely reversible. Less than 3 months, if somebody suffers from kidney disease, if it is uh, it has as a recovery, then we will remark that we'll nomenclature that will stamp that case as an acute kidney disease, and it signifies that the patient the kidney function is reversible. it has a saved kidney right now. But if it is more than 3 months, one has to understand whether you will like it or not. The kidney function, whatever been damaged, is a permanent damage. It's not that by our medicine, by any system of medicine, that kidney function can be reversible. Only point is that we will slow down the progress, will slow down the progress of the disease, and so that patient remains in a status quo position, patient remains well. So that is the part that more than 3 months of time, if somebody gets kidney involvement, jeopardization of the kidney function, then will nomenclature will stamp that case, those cases as a chronic kidney disease. Now the issue is that before I talk about the homeopathic medicine, we have to understand, we have to know the classification, the stages of chronic kidney disease. Is more than 3 months, we understood, and we understood that the more than 3 months, the case will be considered as a chronic kidney disease. And there are 5 stages. The interesting part of these 5 stages is that the stage 1 is important to understand, stage 3 too important to understand, and stage 5 is important to understand. These three category of chronic kidney disease is a very, very important one to understand. If I once we understand these 5 stages, very easily we can incorporate the homeopathic medicine to deal a case of chronic kidney disease. So let us understand that the CKD has been classified in 5 stages. And CKD stage 1, CKD stage 2, CKD stage 3, CKD stage 4, and CKD stage 5. If I talk about CKD stage 1 first, then I have to understand that in CKD stage 1, there is no changes in the kidney function. I talk kidney function, but the kidney is diseased. There is no, there are the 2 kidneys are sufficient enough right now for the excretion of uh, unwanted product in our body. So that thing is being the issue that in CKD, in chronic kidney disease stage 1, the kidney function is absolutely normal. Still the patient is CKD stage 1. We understand this kidney function by doing a GFR, glomerular filtration rate. Nowadays, we call this the estimated GFR. The estimated GFR is a calculated one, and that indicates the kidney function. And if somebody have 90 or above eGFR, we say the patient, the kidney function is normal. So when a person have eGFR 90 or above, it can be 110 too. It can be 120. Absolutely right. Absolutely all right kidney. Still the patient is being considered as CKD stage 1. Now one has to understand, this is a very important part of discussion, that what are the kidney diseases where kidney is functioning well, still the patient being called as a CKD stage 1. Still the patient have a kidney disease. Like, if I give one example that will be absolutely, that will showcase, that will put inputs in your mind that if somebody has gone through a renal transplant, we don't deal with the renal transplant still. Let me talk about that. Somebody has gone with a renal transplant, and you have seen that patient eGFR is say 95. So kidney function is absolutely all right. The excretion process is absolutely going well with the patient. Still, we will say the patient have a chronic kidney disease because the patient have an an organ which has been donated from somewhere. The both kidneys of his own or of her is not there, but the renal function is absolutely all right. So this is CKD stage 1. If I give you another example, that if somebody have a atopic kidney, the kidney is somewhere, not in the fossa, not in the renal fossa. It is located somewhere up or somewhere down in the abdomen. We still say atopic kidney, and it is CKD stage 1, where the kidney function is absolutely all right. It can so happen that the patient have a atrophied kidney. One of the kidney is atrophied. It has been smaller in size. In sonography, somebody has seen that the kidney is smaller in size. One kidney is smaller in size. So this kidney does have every chance of developing chronic kidney disease by going sick from stages after stages. Every chance is there. That is the reason we consider this one, where the kidney function is normal, where the EGFR is normal. Still, the patient have a chronic kidney disease, like this patient have who has a atrophied kidney. So these are the examples. I'm talking about the examples. And you get many patients, a number of patients, that which is a hereditary disorder. If you get a person who has a cyst in the kidney, it can be multiple. There are two types of cyst. One is a simple cyst. It doesn't harm. But if the cyst in the kidney is multiple in number, we call that one the polycystic kidney disease. A person who has a polycystic kidney disease and the a patient does not have geopardization, abnormal kidney function, we call that one the CKD stage 1. Suppose a patient comes to you and says, I do not have any problem, but I had made a sonography from some reasons. And in sonography, it is seen that in my kidney, there are multiple cysts. That can be a presentation of a patient. We do get it. We do get it too. And in the family, there is, if somebody comes to you and you will find out in their family, there are many persons who does have the polycystic kidneys. And there can be family history that somebody died of chronic kidney disease by the age of 60, 65. It can so happen. So patient is afraid that if I have a cyst in my kidney, that sometime in near future, I can get a chronic kidney disease. It is true. If somebody has a polycystic kidney disease, what one can do? It is a CKD stage 1. Let me discuss about the polycystic kidney, because there are many many patients in our clinics, in our hospital, that the patient comes with the polycystic kidney disease. What we will do, if you get a polycystic kidney disease patient, it can be child, it can be adult, it can be old age, and whatnot. One has to examine the blood pressure. You have to examine the blood pressure, because a patient of polycystic kidney disease, they have a higher chance of developing hypertension, because they are in kidney, there are cysts that triggers renin, angiotensin, aldosterone system, and patient develops hypertension. One can get such cases that a patient of 24 years of age, they have a hypertension and they have consulted with doctor, the hypertension, the blood pressure not getting down as desired with the medicine. To every one of us, we try to rule out the kidney causes. We try to rule out the kidney cause. We ask the patient to do a sonography. In sonography, one can get one can get a polycystic kidney. In those cases, if after sonography, one can also decide that if the hypertension not being controlled, it is being refractory hypertension, pressure is not coming down with your medicine in adult. By adopting the lifestyle too, patient has a reduced body weight now. Patient is not taking salt right now. Still, the hypertension is not coming down. Then, apart from the sonography, one has to do a Doppler sonography of the kidney to understand the renal arteries. I'm talking about stage one. And while I'm talking about CKD stage one, I'm talking about the significance of ultrasonography in case of hypertension in an adult or the child. In old days, there will be hypertension. We are not that much concerned. But if an adult have hypertension, then one has to do a Doppler sonography to understand the renal artery stenosis. Renal artery stenosis, if the arteries are stenosed, we call that is a renovascular cause of chronic kidney disease. If the renal arteries is stenosed, the hypertension will not be controlled. A surgical procedure can make this absolutely normal. The patient will be absolutely normal. So whenever we do get a case of hypertension in an adult or in child, excluding the other causes, we always have to focus on the sonography, especially the Doppler ultrasonography. And alternately, one can go for the renal angiography too. But if the in sonography we do get uh, stenosis of the renal artery, then we may not need a angiography, a renal angiography. So this is being the issue that the patient have renal artery stenosis, renovascular cause of hypertension. One has to find out because unless we be alert with the patient who has hypertension, unless we understand the etiology of the hypertension, then we may not we may mislead the patient. So that becomes our responsibility that whenever we treat a patient, we have to treat with all our responsibility. One has to take the responsibility and we have to understand the disease and we have to understand the scope and limitation of the homeopathic medicine, whether it is possible by homeopathy or not. So I was talking about the polycystic kidney disease. The sonography has made the patient have a polycystic kidney disease. Now, what is the target? Whether in homeopathy we can treat the patient or no? The answer is absolutely yes. One can do it, and we can keep the patient a very healthy one. We can prevent the complication of polycystic kidney disease. One of the feature of polycystic kidney disease is that the polycystic kidney disease invites hypertension. So every time we will measure the blood pressure. If the blood pressure is raised, is in higher side, we will ask the patient to do a lifestyle modification. We will ask the patient to to restrict the salt in their diet. And we will, of course, we will give certain homeopathic medicine, and that can be a constitutional law. As we all aware about that constitutional treatment is the best possible treatment in homeopathy, that we agree with this. But to give a constitutional treatment, one has to justify the medicine. There should be there should be several symptomology, the mental makeup, the physical channels, the patient modalities, that has to be considered well, and the medicine has to be justified well. At the same time, we do have a certain medicine. With those medicine, we call this organopathic medicine. Means some of the medicine which comes near to the disease, for the near to the disease, that medicine is organopathic almost, but still it justifies the concept of homeopathy, like it uh, justifies the minimum dose, it justifies that the single dose, single medicine, it justifies that there is a potentization of the medicine, that even the tincture you get 1/10 strength. So what we have a two choice. One is a constitutional one is a holistic one, and second one is a organopathics. We call that one the specific remedies. Specific remedies might have certain roles, but may not be the absolute role. One has to, after treating the patient with a specific remedy, one has to obviously choose by time that the holistic remedy, the constitutional remedy by this time. Because to select a holistic remedy, the constitutional remedy, it takes time. So whenever you are treating the patient with a specific remedy or the organopathic remedies, you get a platform to choose the holistic remedy in which can be applied in near future. So in case of polycystic kidney disease, I'm talking about CKD stage 1. The EGFR is absolutely all right now. It can so happen the patient will step down to the CKD stage 2, sometimes CKD stage 3, 4, 5, and patient can have a renal failure and patient can die of it. So when I get a patient of polycystic kidney disease, I have to remember that if somebody have a polycystic kidney disease, there are certain chances of the patient will suffer from. Number one, patient will suffer from nephrolithiasis, a kidney stone. They will have a kidney stone. And apparently you get in X-ray or in sonography, the patient have a kidney stone. Along with the kidney stone, if you get a polycystic kidney, then you understand, then this kidney stone is because of having the polycystic kidney of that person. Because of the polycystic kidney, the infiltration gets stuck somewhere. That gets in the filtration of the kidney. Filtration of the kidney is being disturbed. And as there is a filtration disturbed, there is formation of the kidney stone. And this kidney stone can go away. If somebody takes a plenty of fluid, and there is no restriction that the patient will have in polycystic kidney disease, unless the patient has developed chronic renal failure. There will be no restriction as such. In CKD stage 1, if somebody have a polycystic kidney disease, no restriction of taking fluid. If somebody enhances with the water intake, the patient much of the water, and patient takes a citrate food, patient can improve with homeopathic medicine. There will be we can improve the patient with the nephrolithiasis. We do have several medicine for kidney stone. We do have several medicine for the kidney stone. And this kidney stone, in this case, has occurred because of polycystic kidney disease. This is one of the complications of polycystic kidney disease. If you get a patient who has a kidney stone, what to do? Let me talk about certain medicine, homeopathic medicine. And kidney stone can be with polycystic kidney, maybe without polycystic kidney. The treatment approach is same. They will treat it. And as we say that there are certain medicine which is holistic one, which is constitutional one, certain medicine which are organopathics one. So let me talk about the medicine. And these medicine we can give to the patient with the minimum of symptomology. Because this, to get a vast picture of the disease of the person is sometimes not possible in single visit. Second visit, third visit, fourth visit, you understand the patient. So in the first visit, one has to understand the certain point of discussion with the can we cure genital? Yes, I will talk into this. Talk into this. Cure, we'll talk into this. Uh, what I was talking about is that if the patient have a nephrolithiasis, the patient have kidney stone. We all know that this, if the kidney stone is the right side, we prefer the lycopodium. We agree with this. But what has justifies lycopodium? One has to understand. There should be certain symptomology of lycopodium that the modalities has to be there. The patient has to have a past history. Patient has to have a family history. Certain point has to justify the lycopodium. Otherwise, it won't work. That's true. It won't work. There, we can also prescribe certain mother tincture, which can be continued for a long time. The several months one can continue with the mother tincture if it is not a nephrotoxic, if it is not a hepatotoxic, or if it is not a neurotoxic. The safe mother tincture, the herbal mother tincture, which has been conventionally been used for thousands of years in other system of medicine, that can be easily, those tincture can be easily been continued for several months, that one can do. So if a given case who has a nephrolithiasis, one has to understand that whether this nephrolithiasis, the kidney stone, is a staghorn type of kidney stone or no. In report we do get staghorn nephrolithiasis has a good anchoring. This gets stuck in the kidney. Those cases needs a surgery. Those cases has to get operated. A staghorn we do not treat. Rest of the kidney stone, whatever can be the size, it can be a 20 millimeter in size. One can go. One can go with the treatment. The kidney stone will break down in the kidney and it will come through the ureter. So if you get a kidney stone patient and the patient have a sudden attack of pain, renal colic, we all know it is a sudden attack, it is a colic in nature. With the kidney stone, patient had developed a acute abdomen. Patient has a severe abdominal pain and which has a side affection, either left side or the right side. And a time comes when patient cannot define Patient says, I do have abdominal pain. What to do with this? If you get a patient of abdominal pain and you understood that there is a pain in the abdomen because it has started in the right flanks or the left flanks, uh, or this patient pain has started in the right renal region or the left renal region and radiating downwards, and the patient is tossing about in agony, severe colicky pain. Patient is bending down and patient is moving from one part to another part of the room. We understand it's a colicky pain. We have several medicine in such cases, but we choose in our practice. Our student does know that if you get a renal colic case, the potency medicine which acts best is the cuprum ars. Cuprum ars is a medicine, what we call as an antispasmodic remedy. I'm talking about a medicine at the bedside which can control your pain. I'm not talking about the absolute treatment of nephrolithiasis. I am talking about acute emergency, where you where usually that the patient asks a patient go to the modern medicine hospital and they get a antispasmodic drug. But if you are fortunate or unfortunate to interact with a person who has a acute abdominal pain, and you could understand by your knowledge, by your vast knowledge, you have understood it is a renal colic, and you have to deal with the patient. Renal colic usually that has a short time stay. It is a 4 to 6 hours. The patient has to suffer in one episode with the renal colic for 4 to 6 hours only. After that, the pain will go down. Pain will be there, but the colicky nature will not be there. So one has to understand what to do in this circumstances. Renal colic. Then one can go for this cuprum R6. You will say, why not Colocin? Agree. Why not MacPhos? Agree. Because bending forward is amylation. Is agree. There is one group of medicine, we get Etista group of medicine. Etista indica, Etista radix, that also have the bending forward amylation. But one has to remember that those medicine agree that one can give it. And we do give. In fact, many of our colleagues do give the Colocin in those cases. And in our real-time experience, we have understood that this cupramars in renal colic, it acts a better way than the Colocin, than the MacPhos. So this is being the issue that how we'll tackle a renal colic. That first line of treatment will be the cupramar 6 or 30, very repeatedly, maybe every half an hour, maybe every 1 hour, one has to give 4 or 5 drops. The pain will settle down. After the pain settles down, one has to make a plan of the treatment. Whether the patient will continue with homeopathy, whether the patient will consult with modern medicine doctor, whether the patient will go for the surgery, that one has to decide. It can so happen in many cases, and we agree with this, that the patient has consulted with the allopathy doctor, modern medicine doctor. And the modern medicine doctor has given some injection to tackle the acute emergency. It can so happen that you will plan for the treatment with the patient so that the renal stone goes away, it gets expelled. But in acute emergency, to get a safe one, though it is not wanted. And we say that the patient, if there is acute exacerbation, you can take this tablet or this injection. You may require, may not require, because patients stay in the village. If there is severe pain, nobody will listen. They will simply go again to the modern medicine to express your idea, express your experience. You say that the patient, if there is acute emergency, you try with the Cupra-Mars. If it does not settle down, then you go for the injection what has been prescribed earlier. This is an honest practice. It's not that this in homeopathy will do everything. Every system has a limitation. When we honestly agree, more you will agree with the limitation, more you will be successful. That the factuals one has to understand, the real-time experience one has to at all. But before giving this modern medicine, before you go with a choice of modern medicine, you have to try with the Cupra-Mars to tackle the renal colony. Now the question is that if somebody have a nephrolithiasis, what exactly to do? What will be our plan? If somebody have a recurrent nephrolithiasis, say this patient suffered with a nephrolithiasis 3 years back, again there is a kidney stone. This stone got expelled out. It has, the patient has passed this renal stone. After 2 years, again there is a renal stone. Number one, patient do not have a habit of taking water, much of the water, it can happen. The patient takes much of the tea throughout the day, tea, coffee, does not take water. Have every chance that the patient will develop a renal stone. Those who have a uric acid diathesis means the patient have elevated level of uric acid. They will form uric acid stone. One has to prevent this one. One has to prevent uric acid stone. One has to prevent the recurrence of the nephrolithiasis. In our experience, we have seen that to prevent the recurrence of kidney stone, the medicine which acts always in a better way is a tincture, or it can be 1x, it can be 3x potency. The medicine is Thalapsi bursa pustulis. We all know that Thalapsi is a medicine that is a metromenorrhagia. But this Thalapsi has a unique power. Thalapsi has a unique potential power to prevent recurrence of nephrolithiasis. By your hard work, you have improved a patient with renal stone. The stone has gone out. Now the patient is free from a renal stone. And you are very happy. And we should be very happy with this, because with our homeopathy medicine, we do not have much of your good experience with the gallbladder stone, cholelithiasis, but we are happy to treat. We are confident to treat the renal stone. That is possible in our system, unless it is a staghorn type of nephrolithiasis. So this is what in nephrolithiasis, to tackle Cupra-Mars could be the best possible medicine, and to prevent the recurrence of this nephrolithiasis, one has to go with Thalapsi bursa pustulis, and it can be in tincture. The patient can take for several months, or it can be in 3x. The patient can take for several months. It can be 15 drops twice daily, or it can be 20 drops twice daily. Now the question is that this is a prevention medicine. That we understood that the patient has no more kidney stone, then Thalapsi bursa. only the history. But the issue is that when a person have a renal stone and we have to treat the patient, it can be in the left side or it can be a right side. Whenever we get a kidney stone patient, we are very much excited to decide we'll go for Berber's burgers. We are tempted to select a Berber's burgers, and it is written in the book in the references that the Berber's burgers is a medicine which is a left-sided one. We agree with this, and we are happy to prescribe Berber's burgers in case of renal stone. But one has to understand that to prescribe Berber's burgers, even in kidney stone, one has to find out one modality, and that modality will speak about that the patient needs a Berber's burgers. That one is a low back pain. It is in left renal region, there is a pain. We agree. The patient also have pain in the lumbar region. It's a low back pain. If the low back pain is there and the patient experiences more pain on sitting, in sitting posture, the Berber's burgers is the remedy for the time being to treat with the patient of nephrolithiasis. We consider if there is this modality that the patient is sitting there and patient sitting aggravation, the low back pain aggravates on sitting. Even in right-sided nephrolithiasis, one can go for the Berber's burgers, but the preference is always the left side. So this is one that to justify Berber's burgers to treat a case of nephrolithiasis, one has to justify Berber's burgers with the symptom the patient have a low back pain, and that low back pain aggravates on sitting posture. That one has to assure about it. Now the question is that there can be several remedies to treat with to nephrolithiasis. And in nephrolithiasis, if you get a patient of renal stone who has right now frequency of urination, there is a frequency of urination with the nephrolithiasis, and patient does have a low-grade fever, patient does have a loss of appetite. We understand there can be, because of understanding there is a frequency of urination and there is a low-grade fever, we can understand this patient can have urinary tract infection. You will ask me that you didn't talk about the burning. Yes, we agree that the patient, if somebody has urinary tract infection, the patient can have a dysuria, discomfort while passing the urine. And discomfort can be in the form of pain, it can be burning or something else too, sensation. But one has to remember that a patient of urinary tract infection may not have a burning at all. Without burning, patient have a urinary tract infection. Patient has a low-grade fever, patient has a frequency of urination. You ask the patient to do a urine culture, you will get the culture is positive and the growth is too high. But the patient does not have a burning. So burning cannot be a hallmark of understanding urinary tract infection. That symptom has gone away. So to decide a person who has nephrolithiasis, kidney stone, and the patient have now developed a urinary tract infection, we have to decide certain things. What was the origin of talk? Origin of talk was the chronic kidney disease, CKD stage 1. And in CKD stage 1, we were talking about the polycystic kidney disease. And we said that in the polycystic kidney disease patient, one can develop nephrolithiasis, one can develop renal stone. Now we are talking about renal stone. And if somebody have a renal stone, what could be the consequences? What could be the complication? The basic platform of talking is the CKD. Then we have come to CKD stage 1. We have come to discussion of polycystic kidney disease. And we are talking that if somebody have polycystic kidney disease, the patient can have a nephrolithiasis. And we are talking about nephrolithiasis right now. If somebody have develops in a case of polycystic kidney disease with or without polycystic kidney disease, with the patient have a nephrolithiasis and develops urinary tract infection, one has to deal with, one has to go with this. And in our experience, that if somebody have urinary tract infection and the patient have nephrolithiasis, there are two medicine which we call as a celebrated remedy for urinary tract infection. It's a wonderful remedy. Number one is sarsaparilla. Sarsaparilla and the lycopodium is a celebrated remedy for urinary tract infection in a case of nephrolithiasis with or without polycystic kidney disease. That one has to agree with this. So to deal with a patient of urinary tract infection, one has to go with the sarsaparilla and the lycopodium to control the urinary tract infection. So there can be many ways out that the patient should adopt to control the urinary tract infection. There can be several medicines. There are certain there are some patient which you will encounter in our practice. There is recurrent urinary tract infection. The patient keeps on taking this antibiotics. Almost every 3 months, 6 months, the patient is suffering from urinary tract infection, and patient always takes antibiotics. Still there is recurrence. It can happen. What will be our approach? Our approach will be to treat this patient with an antipsychotic drug. Because recurrent attack of urinary tract infection that keeps usually the antipsychotic features. I'll give one example that the patient, one patient example, and that is you can also apply this remedy. The adolescent girls, say the girl's age is 19 years old, and you are treating, the patient has reported to you and says that, doctor, I suffer from recurrent attack of urinary trouble. What is the trouble? There is a frequency of urination, there is a dysuria with the patient, and there is a low-grade fever or the high-grade fever. And whenever I go to the allopathy doctor, they ask me to do urine culture, and in culture there is a growth in the bacterial growth. And always I take the antibiotics. And now what to do with this? I want to get rid of. I want to avoid the modern medicine. I want to avoid the antibiotics. We will get this kind of issue. So in adolescence period, if somebody have a recurrent urinary tract infection, apart from saying that you take much of the water, much of the fluid, apart from that, we do have a certain responsibility that we have to give certain medicine. There can be many medicine, antipsychotic medicine. But one of the medicine I would like to talk, the name of the medicine is psychotic compound. It is available in the market for long period. We are getting this in the market. It has a wonderful effect on recurrent attack of urinary tract infection, particularly in adolescent girls. Particularly in adolescent girls, one can try this psychotic compound if the symptom corresponds. Now one has to understand. How we will understand a psychotic compound? Psychotic compound is basically thuja. It has all the feature of thuja occidentals. This patient can have what too? The moles, what? It can have. The patient is absolutely chilly patient. It's like again a thuja. And there are feature that there are profuse sweat over the head. Here. Profuse sweat in the head. Sweating over the scalp, like calcarea falls, like calcarea cup, like sanicula, like silicea. This patient have profuse sweat over the head. This psychotic compound. And patient will have a low back pain like calica. Patient also have this psychotic compound patient also have an intolerance of egg, anda, this intolerance to egg like ferment. They cannot tolerate egg like ferment. These are the symptom, few leading symptom of psychotic compound. And this psychotic compound makes a wonder if somebody have a recurrent attack of urinary tract infection, particularly in atherosclerosis girls. We do have certain real-time experiences with those category of the patient of the atherosclerosis period. The patient have a recurrent attack of urinary tract infection. And with the psychotic compound, the patient does not suffer right now. With so much recurrence of urinary tract infection, it can so happen the patient gets some episode of urinary tract infection, but the frequency of the recurrence that that gets improved. They get a long gap frequency. In some of the cases, they do not get urinary tract infection. So that was one of the remedy. This like psychotic compound, if symptom correspond, it's possible with the cantharis too. It's possible with your thuja too. It's possible with the lycopodium too. One if the symptom corresponds, because in homeopathy we do not have a very specific. We do not kill the bacteria. We ask the body to kill the bacteria. That is the basic difference, and that is the reason that we do have multiple remedy for one disease condition. So I was talking about nephrolithiasis. In nephrolithiasis, if you want to be very safe, I don't want to be too much involved in the treatment procedure, and the patient have certain symptomology to decide for a constitutional remedy, and we have given the remedy. The patient is not improving, and you want a very safe treatment. Then there is one tincture which can be given to the patient very safely. You understand, only understanding there is a nephrolithiasis. It usually does not require any symptomology. The medicine in tincture we do give is Osimum can. Osimum, there are two variety, Osimum osantum and one Osimum can. So Osimum is a tulsi. That is, we during our puja we use this tulsi leaf, and we take this tulsi with the prasad that we take, and this tulsi has a tremendous medicinal power, and it is an anti-inflammatory one. And we have seen this, if we give this Osimum can tincture in a case of nephrolithiasis, the patient can take this Osimum can in tincture for several months, and there is every possibility the patient gets the expulsion of the kidney stone. And we become very happy with this. It's not that the patient it's not that the patient will not have a constitutional remedy. It is not that the patient will not have a remedy which is organ specific in potency form. Patient will take, but that is in interval. Lycopodium 30, if we are given Lycopodium 30 in 20 days back, and patient is continuing with Osimum can, there is no harm into it. One can go with the treatment of Osimum can. After some days, you will repeat the Lycopodium after 1 month. But in between, the patient can continue with the Osimum can in tincture. So this is being the issue, that Osimum can in 20 drops twice daily. We can continue with this to treat a case of nephrolithiasis. Let me finish. Let me continue with nephrolithiasis today, and I'll talk about certain remedy that requires in case of nephrolithiasis. If there is a hematuria, I've talked about urinary tract infection, certain remedy. It's not an exhaustive one. It's not that this is the limit of the remedy. It's not that, absolutely no. That are the examples. These are the examples only. So to continue with the examples of medicine, that if somebody gets hematuria, there is every possibility. With nephrolithiasis, there can be hematuria. In polycystic kidney disease, the cyst can rupture. This is an interesting one. A polycystic kidney disease patient does not have a renal stone. Say, if there is a polycystic kidney disease, does not have a renal stone, and this cyst gets ruptured in 1 day, there will be hematuria. And for our information, one has to understand that there will be some, in first day, there will be hematuria, and from the next day onwards, the color of the urine will be less darker, less darker, less darker. After third day, we'll find there is no more hematuria. Do you understand your medicine has acted? It can be possible. It may be a spontaneous one. But once it ruptures, there is again chance that there will be urinary tract infection. In fact, the kidney will be infected, or what we call as a pyelonephritis. So every chance that patient develops a pyelonephritis, that is not wanted. One has to treat with the patient. So whenever we get a case of hematuria, in a case of polycystic kidney disease, or in a case of nephrolithiasis, because when the stone goes down, it gives abrasion in the ureter, in the wall. That creates a hematuria. If we get hematuria, every homeopath, they will 100% they will give Apis mellifica. And we agree with this. That Apis mellifica is a medicine for the hematuria in a patient who has a polycystic kidney disease or do not have a polycystic kidney disease, who have a nephrolithiasis or do not have a nephrolithiasis. If there is a hematuria, we do not have much of the remedy which gets much of the benefit like that of your Apis mellifica. Apis mellifica in lower potency, in 30 potency, if we prescribe, the hematuria gets arrested. So that is wonderful. But it is true that like that of hematuria, we do have another remedy which has a very dark color urine. I'm not talking about the colchicum. The inky color is again a dark color. I'm not talking about the colchicum. And I will not talk about the colchicum. I'll talk about the real-time experience, what one can go with the remedy when you get a case of hematuria. If there is oliguria, there is a less output of the urine. With the onset of your alteration of the urine color, the patient has started the oliguria. Both are going neck to neck. the color of the urine is altered one and there is a less urine output. The patient gets a kind of dysuria while passing urine. The more the color is dark, more the helleborus is indicated. Now we will forget about Apis mellifica. We will recall the drug is a helleborus one, and it will definitely improve the condition. So I talked about this two remedies in hematuria. There can be several remedies to control the hematuria, but one has to go with one with the drug like Apis mellifica and your helleborus. If a person have a now the patient have the stone is coming out, it is getting on, this is on the way of expulsion. You understand some of the gravels of the stone is coming down, and one can palpate, and the patient says that I do have a sand like expulsion, and we say we are habituated to understand red sand in urine, what is there in the lycopodium. Similarly, possibly it acts better, this remedy, than lycopodium. When you get a feature that in the end part of expulsion in the patient urethra, patient experience much of the dysuria, and with the dysuria, patient gets some sand-like structure. Patient can see, and if the patient palpates, the patient understand there is a grubbles, there is a something hard that is coming through the urine. Then the medicine we we understand, and it has been practiced in Kolkata for long period. And when you study this remedy in Bengali language, uh, in Bengali book, that the patient have red sand like, the patient has a gravels in the urine, and patient is in dysuria, we prescribe equisetum hyemale. Equisetum, then Hyemale. Equisetum hyemale is a wonderful remedy when their stone is about to expel out, and the patient have much of dysuria, and one can palpate the sand-like structure in the urine, and all the patient experiences something sand-like is passing on with the urine, then one can decide for equisetum hyemale. And today is Sunday, and we have covered 1 hour of time. And as we mm, have decided that this session will continue maybe every 7 days, maybe every uh, 15 days, maybe monthly. So I would like to take my permission from my seniors. I have seen some our very respected seniors. They are also watching my program. I'm thankful to them, um, and I'll request them to continue this webinar uh, where I will be talking about, and I'll be talking about the real-time experiences. I will continue with this. I will volunteer to do this, and I'm very thankful to our students in Sri Lanka, especially to Dr. Asan, that he has made this platform to talk uh, about certain diseases, and we will be covering almost all diseases. But today's discussion regarding the chronic kidney disease, I believe that only 7% has completed. we will continue with this. We'll continue with this. Then we'll step forward to certain other system, and we'll continue this. We believe, or we'll continue this thing. As today is Sunday, I cannot give much of the time, and you also have certain programs. Our seniors also have certain programs. So I will request Dr. Ashan that I would like to send this message is that we could not complete the CKD discussion today. We have entered into the platform and we covered at least 7 to 10% of the talk. And in next stage, we will be talking about this, and we will talking about the chronic kidney disease. Our target is that we will improve our quality. Our target is that we will not avoid treatment by homeopathy system of medicine, understanding that homeopathy will not work. It's not true. Homeopathy works, and one has to be serious. To my students and to my younger generation, this is my message is that you have to go through the book. Even you can get discussion, very good discussion in the YouTube too. This discussion one has to listen to. In YouTube, you will get the modern medicine aspect of every disease. You can improve yourself like anything by listening YouTube. One has to go through the book, but one has to be a responsible doctor. That every disease is not possible by homeopathy. You go to allopathy, and we will enjoy only the GI system. It cannot be a true one. You have to take the responsibility. You have to be very serious about the treatment procedure. Whenever you treat a patient, one has to be very serious. And you go through this. That could be the possible reason that I'm talking about in this webinar today, because you have seen those who have passed from National Institute of Homeopathy, you have seen that in our hospital, how many patients does come to our hospital. Those who are passed a long time back for their information. Nowadays, we are crossing 4,000 patients in a day. 4,000, not all the day, not all in all day we do have 4,000. But we cross every day 3,000, and sometimes it touches the 4,000. So if we can treat efficiently this number of patients, this is also possible in Sri Lanka. But one has to case. I'll answer this. In case of UTI, yes, albumin is there. Well, I'll talk to this. So this is that my request is that you be sincere and you give a devotional time to for the treatment procedure for the patient. I could see. Could you again send the message? Just I'll read it out and I'll answer this. Or you can talk to me. No problem.
Sir, now, excuse me, sir.
Yes, sir. Yes, sir.
I'm a Dr. Anbanandan from Sri Lanka Homeopathy Council. But anyway, thanks for the council. Our chairman organizes this. Sir. Now, sir, we are given a comprehensive report regarding this CKD. Very, very comprehensive report, sir. Excellent. But sir,
yes.
In our urine, sir, now urine, there's a very important. You are not mentioned our color code. Just the urine, there are in our through the urine they can see the disease of the patient. Yeah, and same time albumin layer also coming, sir. Then we are not spoken regarding the albumin, the color of the urine. What is the cause, sir? Because that's a very important.
Yes. I'll talk into it. Very good question. In fact, that you get when a person have a chronic kidney disease, you get a foamy urination. It's a foams in the urination, and you have to train the patient that when there is a foamy urination, after giving one flush in the toilet, if the foam goes away, then you don't have to be worried about. If the foam is still there, you understand there is some issues in the urine, some issues in the kidney function, maybe very minimal one. As our doctor was saying about the albumin in urine, agreed with this. This albumin in urine in childhood, in lesser age group, that we do get in case of nephrotic syndrome. And this nephrotic syndrome in children, where there is a urine, in urine there is a albumin, that is a concern. Because once there is a urine, in the urine there is much of protein, we call as proteinuria. In the blood, the protein level goes down. If in the blood the protein level goes down, because of certain mechanism, the patient develops anasarca. Patient develops a generalized edema. And that is what the finding of the nephrotic syndrome. And there are several causes of the nephrotic syndrome, that we do get nephrotic syndrome with the glomerulonephritis. We do get some membranous glomerulonephritis. We do get in case of polypharyngeal glomerulonephritis. We do get in case of focal glomerulonephritis. But the interesting part, apart from the discussion of the nephrotic syndrome, that nephrotic syndrome can be treated, and nephrotic syndrome has to be treated as up to the age of 12 years. After that, the patient can get a recovery from the nephrotic syndrome once your treatment procedure is good one. But possibly our question, what has been made, is for the chronic kidney disease, and that is for the aged one. To answer the albuminuria, to answer the proteinuria, to answer the foamy urination, to answer the complication of diabetes, to answer the complication of hypertension, the answer is same. That is proteinuria and proteinuria. We say maximum of the proteinuria, maximum of the albumin, the drug is terebinth. It's a unique one. The drug is terebinth. Terebinth is a drug for, if you ask me what is the medicine for proteinuria, the answer is terebinth. But to prescribe a terebinth, one has to go with the symptomology. But it is also true that you understand massive proteinuria, one can go with the terebinth. Now the question is, if a person have a hypertension for long periods, say 15 years of hypertension, 20 years of hypertension which remain uncontrolled or maltreated or not treated. Fortunately, patient did not die of ischemic heart disease. Fortunately, patient did not die of cerebrovascular accident. Now the patient have a complication of hypertension in the form that the patient having protein in urine. One point is that we ask the patient, if the patient has hypertension for long period, we check the patient in routine examination of the urine. Nowadays, we ask the patient to do urine ACR, UACR, albumin creatinine ratio. If it is more than 30, we understand there is proteinuria. So this is a routine checkup with the patient who has either have a diabetes or have a hypertension or both. Once you understand that there is proteinuria, there is no effect in the body. This EGFR is absolutely all right. We say it is a CKD stage 1 once there is a proteinuria. It is a good discussion, in fact, if a person have a albuminuria, if a person have a proteinuria. So if a person have a diabetes and has developed proteinuria, the medicine, we do have many medicine, but the celebrated remedy for proteinuria in case of long-standing diabetes, treated or untreated, that controlled diabetes or uncontrolled diabetes, once there is a proteinuria in diabetic patient, the remedy we call as a celebrated, that is a Ras aromata. Ras aromata. ras aromatan 30-200 potency, it will arrest the proteinuria if the patient is diabetic one. Similarly, if there is a proteinuria in a case where the person has a hypertension, patient has suffered from hypertension for long period, it has been controlled sometime, it can be uncontrolled sometimes, sometime treated, sometime not treated. There is an irregular treatment pattern of the patient of hypertension. The patient has not been given a much of the focus to control the blood pressure in a limit, and patient now develops a proteinuria. And you understand this proteinuria by doing the UACR, means urine albumin creatinine ratio, or by doing a 24 hours urine protein. You understand there is a proteinuria. If it is a hypertensive case, has developed a proteinuria, then the celebrated remedy is the Biscum album. Biscum album. Biscum album in 30 potency. That is one point. If you ask me that this, if the patient have a proteinuria and we do not know the symptomology, patient is a diabetic one, patient is a hypertensive one, now have a foamy urination, now patient has developed a certain elevation of the urea and creatinine level, the patient has EGFR has gone down below 60 or below 40 or below 90s, the patient have certain complication with the CKD, and we understand the patient has developed chronic kidney disease, then I have to continue certain medicine, which is a very safe one and will give some of the benefit. The medicine is Senna in tincture, SENNA. Senna in 1x and 3x potency or in tincture, that works best. Senna usually we give in case of constipation of the infants, of the child who has acute abdominal pain with constipation, we give a Senna. Like if an infant cries, you do not know why the infant is crying. We understand it could be because of abdominal pain. We understand it could be because of the earache. If once we understand there is a abdominal pain, we give a Senna in 30 potency or 6 potency in children. The same medicine acts in a better way, acts in a case of chronic kidney disease when there is a foamy urination, when there is abnormal constituents excreted through the urine becomes a foamy one, and there is a possibility or with evidence of proteinuria or possibility of the proteinuria, then we give, if we get a constipation in those cases in renal in renal compromised patient, if the patient is having chronic kidney disease and has developed foamy urine with a suspect that the patient have a proteinuria and has developed a constipation, one can choose the drug in tincture in 1x, in 3x potency. The medicine is Senna, SENNA. The Senna could have a choice. We do have several remedies for proteinuria.
Another question,
But
sir,
let us limit up to this, that we do have a good platform to choose the medicine for proteinuria. Sir, I believe that you got your answer.
you're correct, sir. Sir, correct. You're very good. Excellent. Answer is okay, sir. But now if we compare this male and female, this albumin is less, sir, because normally pregnant woman, why, sir? Pregnant woman more. You can indicating this albumin in females, not males, more are in females, especially they are in a pregnant time frame. Why that, sir?
That needs sir, a review, that whether the patient in pregnancy has developed a CKD or no. If there is no evidence of CKD, only the protein is going on, then ideally one has to consult with the gynecologist whether there is a possibility that pregnancy induced proteinuria. That part in my literature is not available. I'll go into it. I'll answer into it. But if the patient has a kidney function jeopardization. If the patient has a certain kidney problem, like congenital kidney problem, like atopic kidney, like atopic kidney, atresia of the kidney, or the patient have hypertension in past, or the patient has a diabetes in past, then one has to, this is a medical cause, and we have to, whatever medicine we have discussed right now, those medicine can be applied safely, because the tincture what I has mentioned is absolutely kidney friendly and not a hepatotoxic one, not a neurotoxic one. These remedies can be applied to the patient. And to get the diagnosis, if it is the renal function is absolutely all right, then one has to find it out with the consultation of the gynecologist, because why there is a albumin in the urine. It can be possible that the patient with the pregnancy can have a urinary tract infection where there can be albumin in trace amount at least. If it is a trace amount, I believe that doesn't need much of the attention. But if exceeds if the patient exceeds the trace albumin level, then it needs a treatment. And we understand it could be possible that the patient somehow the kidney has been affected. And these drugs, what we have talked about right now, can be applied to this patient who have a pregnancy, and the patient will continue with a safe pregnancy, because we haven't talked about the drugs which are toxic in nature.
Thank you, sir.
Thank you so much, everyone, for your patient hearing. If you are interested, if you are really want to improve your quality of prescription, my smart effort, if it comes in your help, I'll be always there. I'm very familiar with the students who has completed their BHMS from our institution. I've always been with the Sri Lankan students. They are so good. Still, we do have a number of Sri Lankan boys and girls, and every day almost they come with some of the for some consultancy to me. I'm very thankful to them. This is a legacy, in fact, because their senior has said to consult with me. That is, I'm very lucky into this, and I believe that this session today was informative. And whenever the Dr. Ashan decides for a next such webinar, I'll be there. Now with this expectation, I would like to thank all the participants who has participated today. And I could see that this meeting is being recorded, and I believe this record will keep this record, and this record will you will pass on to those who will be watching in future. I would like to, who hasn't joined today, I'd also would like to thank them for watching. Thank you so much. Thank you, my seniors who are sitting, who have spent so much of time in Sunday. And I would like to thank Dr. Asan and his team for inviting me in this platform. Thank you so much.
Thank you, sir. Thank you for the amazing lecture.
Thank you.
Your guidance are invaluable, sir. And we will continue this lecture for next time, sir. Then I will talk with you. And
yes.
And also thanks for all the doctors, those who are participating. And
yeah, Dr. Asan, there is a small request to you.
okay,
Pay my respect to the seniors who are watching this, and get a feedback from them, because
okay, sir.
we may need to improve our lecture.
Okay.
According to their wish, according to their direction, we will be talking. Everything is possible. The direction I need. If this direction is good, I'll continue with this. If the direction needs to be altered, we'll alter the direction of talk.
Okay.
Right? Get the feedback from them. Thank you. Thank you so
Doctor,
much, Dr. Ashan.
Thank you, sir. Thank you. Doctors,
Right.
please send your feedback to my WhatsApp. So then I will talk with sir, and whatever the doubts you are having, just send it to me. Then we'll talk with sir, and we will clear it out in the next class. Okay.
Right.
Next
time we'll continue. Next time we'll continue with CKD.
Okay, sir.
Thank you.
Okay. Thank you for your time.
Okay.
Thank you, sir.
Okay.
Thank you very much.
Sir. Thank you, sir.